I'm honored to be in conversation today with Kathy Giusti. She is a business leader and known as a healthcare disruptor. She is a two-time cancer survivor, having been diagnosed with multiple myeloma and breast cancer. She co-founded the Multiple Myeloma Research Foundation, where she served as CEO and president for nearly 2 decades. She also co-chaired the HBS Craft Precision Medicine Accelerator, which she helped found as a senior fellow at Harvard Business School. Kathy is widely recognized as a pioneer in precision medicine. She has been named one of Time Magazine's 100 most influential people in the world and was ranked number 19 on Fortune's list of the world's 50 greatest leaders. Kathy was appointed to President Obama's Precision Medicine Initiative Working Group and was an advisor to the Biden Moonshot Program. She was named to the President's Council of Advisors on Science and Technology, the National Cancer Advisory Board, and the National Cancer Policy Board. She has been published with articles in the Harvard Business Review, Time, Forbes, Stat, and Nature. Kathy has an enormous breadth of experience in the cancer space. I've known her for many years. She has been a great sounding board for me professionally, and I participated in some of the activities and initiatives she led at HBS through the Precision Medicine Accelerator. And because of that, this community has benefited greatly from her wisdom. So I want to thank you, Kathy, for joining me today for this important conversation.
Stacie, it's great to be here. It's great to see you.
We're going to talk about a new book that you are publishing that is just going to be coming out. It's called Fatal to Fearless. I read the book this week and I just found it so enlightening. And in some ways, very directive and in many ways comforting. I thought it was an insightful biography, sort of a raw and vulnerable parenting and relationship manual, and an inspiring HBS level course on how to face a cancer diagnosis head on and map out a treatment pathway. So, Kathy, can you tell me just a little bit about why you wrote the book and what issues you were hoping to address?
Sure. I wrote the book because, and you've seen this too, Stacie, over the past number of years, the science has been absolutely amazing. And it's, again, variable across cancers, depending on, which cancers are responding to what. But overall, from where I was when I was diagnosed with myeloma in 1996 to where we are today, there's been so much movement. But I still feel like the system looks the same. So, there were decades between my myeloma diagnosis and my breast cancer diagnosis, but the system still was equally as frustrating both times. And I think over the years, I've coached probably thousands of patients that reach out to me, and I'm sure you get the same calls too. And when the patient calls and you walk them through, like 15 minutes later, they'll say to me, oh my God, like 15 minutes with you just saved me 5 months of aggravation in the system. And I feel like I understand things better and I have much more hope. And I thought to myself, this is not a sustainable model, doing this as one-on-one phone calls. And yet I knew the information was so critical, and that the questions I was asking and the way I was working with the patients was something that was, we were able to standardize. And I think that's the beauty of the book. I think what you just picked up on was probably the hardest part of writing the book. And I'll be honest with you, I actually don't read what to do books. I'm just not that kind of person. And so I felt like if I was going to write a book that people would really be interested in, I had to make it part memoir so that you could understand there are always characters in the book. There are stories that will help you understand the second part, which are the what to do's. But then I also wanted to make sure I got credibility and interviews with experts in the book too. So weaving that tapestry of the book and still making it an easy read, and the 12 steps fully understandable was so important to me. But you are right. It does help you to understand, like, it's hard to be a patient, it's hard to be a caregiver, and it's even hard to be a healthcare worker in this system.
Yeah, I agree, Kathy. I thought the book was laid out so well and it was so readable. It has 3 sections, and then each of the sections have 4 steps, which forms sort of a patient checklist that you talked about. And these are areas of importance that patients or caregivers need to address. It takes them from basically a brand new cancer diagnosis and helps them move through the system toward long-term survivorship. It was so helpful and informative. I wanted to ask you a couple questions based on the checklist. First, I want to ask you, you have talked with hundreds of patients, maybe thousands of patients over the years. What are the top 3 things that you tell a newly diagnosed patient when they come to you for help?
Yes. Well, here's the thing, in today's world, a newly diagnosed patient often means that they have seen the information on their portal, sometimes, often, before the doctor has. So step number 1 is you're looking at those test results and you're maybe seeing it for the first time. It's really important, especially when you're looking at the portal, to make sure you're copying the words of exactly what they're suspecting. Because the next step that everybody takes once they start reading this or they hear the words of what they have is they go to Google and they start going online and researching. And that's okay. Like, I understand that. That would be the first thing I would do too. But what you have to do is as soon as you put those search words in, you want to make sure you're doing it right. So if you know exactly what your diagnosis is, what the form of cancer is that you have, if there's any information in there that helps justify like the staging, or if, in a world of precision medicine, you start to get more information on a subtype, that's what you want to be putting into the research so that you're looking at your own information. The second thing I say to everybody is it's kind of interesting, but we're very fortunate. And it took me a year and a half of research to realize this. I don't know why, but as soon as somebody gets diagnosed with cancer, it is an easy win to go to any of our cancer.gov, cancer.net, and cancer.org. Any of those, which are the National Cancer Institute, American Society of Clinical Oncology, or American Cancer Society. Those are good, reliable sites that you can go to just for an overall cancer generalization. So I highly recommend that. But then I also say to everybody, put in the form of cancer you have and patient advocacy group or research foundation, and make sure you're looking to see if there is a foundation that is specifically focused towards your cancer. So, in this situation, here you are running a foundation, and I know what it's like having run the Multiple Myeloma Research Foundation. You live and breathe your cancer, and you guys know everything about it, and you don't have a favorite drug or a favorite doctor or a favorite trial. You just want what is right for every patient. So you serve as the best trusted third-party resource for the patients out there. So they've got to move from putting in the right words, going on to Google, making sure they're looking at the right sites, making sure they're going and finding the research foundation. Don't stop there, because you have to give your email to the organization. And I don't know what % of patients give you their emails, but I know running the MMRF, I used to be so frustrated thinking, why isn't everybody giving us their email? And I know there's privacy issues or things like that, but the value of the information you get from an organization is so worth giving an email and also calling the organization. So that's how you do the research. But the other things I really do advise are getting a second opinion. And there's a great story in the book that I talk about where I headed off to the community center. We had just moved to Connecticut, and I was lined up with a hematologist oncologist there. And I got in and I'm just sitting chatting with him. And it wasn't that he was doing anything wrong. It's just that I'm such a type A research person, and I'm pulling out everything I've studied, and I'm thinking this man is going to share 100 things more with me. And he was just really laid back. And I just thought to myself, I don't know if he's as wired like I am. And so I got frustrated, and I said something to the nurse, thank goodness, as I was leaving. And she said, "Oh, there's another doctor in the practice that's just like you." And she said, "Just go ask for him." And at first I thought, oh, I don't want to hurt this other guy's feelings, but you really have to do it. And I did switch, even within that practice. And it was an easy switch for me to make. And I ended up with a doc that I really adored and is still there. And I'm great friends with him. So don't be scared of getting a second opinion. Don't be scared of finding the right doctor to work with you. And then finally, just make sure you're calling your insurance company and your whoever your coverage is with, because the out-of-pocket expenses can be just way too high, and you don't want to get hit with those. They're just more stress. So that's kind of takeaways on the newly diagnosed space.
Oh, thank you. That's so helpful. I think, especially the story to give courage to patients to, you really want to find a provider that matches your energy.
Yeah.
And has the same goals in mind that you have and will support you because you're in for a battle and you want your people on your team. So thank you for sharing that.
Sure.
Treatment for cholangiocarcinoma patients often starts within weeks after a diagnosis because the patients are most often diagnosed late stage. Can you share your recommendations for patients as they start looking at treatment options?
Yeah, so when you actually get to that second part of the book, which is where we're focused on the treatment side, and you are in this interesting situation where people are diagnosed late stage, and that makes it trickier. It really does. Reminds me more of the ovarian side and things like this, because in myeloma, we have a smoldering state, and kind of sometimes patients are moving more gradually through the disease. But no matter what happens, when you're doing this quickly, you have to, number one, find the right sites for you very quickly. And I think that's where, I always refer to patients, the NCI helps here, you help here. It's word of mouth, but you have to understand, where are you going to find a doctor that sees patients like you? And that's the most important thing you can do. I often tell patients they need to understand in this heart of the equation, do they want to go to a community center, an academic center, or an NCI designated cancer center? And in your situation, like, the patients are having to make that decision quickly. So that's one of the reasons I say, here's the NCI designated cancer sites, just go right to their website. And I, write about that in the book. What a patient decides to do is based off of their particular situation. There are patients that are working, they cannot even think about getting to the city for an academic center, never mind getting to an NCI designated cancer center. It's okay. But if there's a chance that you can, it's highly recommended. If you have to stay at the community, that's not a negative. Just be at a community center that sees the most number of patients in your area. Now, once you've done that, you have to move out and say, okay, now I need to understand what the treatments are that are available to me. And again, they're going to come back to foundations like yours to understand what are the treatment options and make sure that they've gone through that. Because one of the points I often make to patients when they're discussing treatment with their doctor is, on average, our patients have 16 minutes with their oncologist. 16. So if you haven't done a bit of the research beforehand in terms of general treatments, it's really hard for you to use those 16 minutes wisely, because what you want to be talking about is, what is the right treatment for you, for your particular situation. And sometimes that's going to be based off of additional testing that they may need to do as well. And then I often say to people on the insurance side, just know that the standard of care is often documented on the NCCN guideline site. So that's another place that I sometimes send patients, just because they want to fight for what they need from the insurance company. And so if there are things in there above and beyond what they're seeing on NCCN, you just have to have a doctor's office that's going to go to fight for you and with you.
Mm-hmm. And many of the, one of the things I really loved about the book is there are listed so many resources to help in all of these areas.
Yeah.
Especially with patient navigators and a lot of other things like that, that can be so helpful when you're looking for resources to support you. You talk about in the book rethinking what matters, or establishing a North Star and the important questions a patient needs to ask themselves. This is a lot already. It's a lot for a patient to handle. Can you just share why you included this in the book, why this is so important, that for patients to make sure that they're really thinking about those and asking themselves those key questions?
What I realized, and Stacie, do you remember that when I decided to start writing the book, I had to bring out 26 journals. And I had started writing in a journal for our daughter. She was 18 months old at the time, because I was supposed to be dead in 3 years. Myeloma is just an incredibly fatal disease when I was first diagnosed with it. And so I thought, I'm going to write a journal so that I can, document our 3 years together, and at least she'll know me. She may not remember me, but at least she'll know me from the time we spent together. And so I talk a lot in the book about two things. One is know your needs, and then know your wants. The needs that I explain to everybody, and the reason they're so important is just it's the immediate, oh my gosh, what am I going to do about this when you get the diagnosis? And that's usually who's going to pick my kids up from school? Who's going to take care of my mom and dad? I have to get to work. Our insurance is through me. How are the errands going to get run? What if I can't drive? Those are the immediate needs. You need to write those down because it's going to come back to developing a caregiving team that can support you. Then the other side of it is what I learned when I read these 26 journals back from beginning to end, from writing to my daughter when she was 18 months old to when I write to her today and she's 29 and I have a son who's 26. And I read all of them back to back. And when I realized when I was first writing to her, I kept, it wasn't even so obvious to me, but I kept writing about how much I wished that she had a sibling. And I know part of that was because I grew up with an identical twin and I'm still so close to my identical twin. And I wanted her to have a buddy. And I kept writing about it, but I wasn't talking about it because I just thought people would think I was crazy. You've just been given a death sentence and now all you're thinking about is, having a child. And that seems nuts. But my North Star, as I kept writing in the book, was I want to keep doing, like we found my cancer when we were trying to have our second child. And I just wanted to show I'm going to live like I'm going to live. I want to have this second child. I want to expand our family. And I want to leave my husband and my daughter safe with another child. And I hope if I leave my family safe and happy and with some memories, that was my North Star. Build our family, create memories. And I wrote it down and I talked about it a lot in my journals. But the point that happens later on in the book, as you realize reading it, is when I had to read 26 of them back to back, I realized that I lost my North Star. I got so wrapped up in finding a cure for me, for everybody, that there were just a lot of things I missed. And I also realized how hard my journey had been on my kids and my husband and my sister. And so that's why I wrote it that way, because I think reading those 26 journals back made me understand the role of everybody who loves you and trying not to lose your North Star. And it was really funny. There was a story, I didn't have this in the book, but there's a case study on the MMRF and my leadership up at Harvard Business School, and they had asked me to come up and just teach it. And I remember one of the questions I got from one of the students that gave me the clue here was, you worked so hard to have your son, then why did you keep working? And it was a really tough question. And I know the answer was because I was petrified I was going to relapse and I wouldn't have the next thing. But at the same point, it's like if you could spend less time saving your life, which I hope this book helps people spend less time saving their life, then maybe you have more time to live it. And that's the whole point.
Yeah. Kathy, so inspiring. I read this book the last 3 days and just thought so much about the courage it took for you, knowing that you had smoldering of that type, that you had a little bit of time, but to know that you really wanted us to have another child and to do that regardless. And just think if you had not done that, and here you are, 25, 30 years later, and with 2 children, I just thought that was such a beautiful part of the book for you to share. So
yeah, it's so important that people understand what is it that you want. And it doesn't have to be, like I find for me that my book it's different because not everybody has a great husband, a great boss, that's going to go to bat for them, a great insurance, 8 friends that are going to step in, a sister. Like not everybody has it. I have everything going for me, everything. And yet I still get it wrong. And that's kind of the point of the book, is to say I should have had the perfect journey. And I messed up too. So if you feel like this journey is hard, it is. And it's not you, it's the system. So just keep working through it and we'll give you the steps and get you there. And I think on the North Star part, it doesn't have to be something as aggressive as having another child, but I have plenty of patients that just say to me, I would love to just travel, or I have to see my daughter's wedding. I need to spend time planning this wedding, and I'm going to be at her wedding. And that's what you're looking for. And you set these goals and you're doing the best you can. And so once you write it down and say what's important to you, stay with it.
Yeah. Thank you, Kathy. So important. I wanted to follow up on something that you said, which is I was really struck by the community that you were able to gather around you. You had a group of 8 close friends, and you moved closer to your parents, your husband's parents, your husband, your sister,
Yeah.
and many patients do not have a support system like that. You give some resources in the book if you don't have resources like that. But can you just share some things that might be helpful to patients who do not? This I you My brother, when he was diagnosed, we just had a huge support system as well, the same as you.
Yeah.
But many patients don't have that, and it's scary enough when you do have a support system.
Yeah. It's really scary. And what I do find though is that for a lot of patients that think they don't have a support system, first of all you need is one or two. And I find that there are people that are going to be more than happy to help you, but you're really nervous to ask them. And I think that's a lot of what happens too, is like you're nervous to ask them, and yet the thing is, many times they're waiting to be asked. And so I find if there's an area that you really struggle with a lot and it just gets you stressed and emotional. So for some people it's like dealing with the insurance. For other people it's they don't know how to go online and do the research and really understand the disease. And for others it's like maybe they don't drive. Like whatever it is it's really getting and gnawing at you, pick that area of high stress for you and try to find one person that's willing to help you. But also understand that there really are resources available. So again, they can call your organization, they can call American Cancer Society. There are, people that will pay for you to get rides and things like that. And then also work with a hospital, because the hospital does have navigators, social workers, people like that. And so sometimes I find that the patient is nervous to ask a friend or family member for help, but they should, because just one or two people make a big difference in your life. And the second is the medical community itself will help you. And so don't lose sight of that. And people don't mind. They don't mind. And I kind of, we can talk about caregivers later, but the more clear you are about what you need and how people can help you, the better off you're going to be.
Yeah, I agree with that. It is hard to ask, but I think in my life, just in my friend groups, neighborhood and things, I think one of the saddest things for me is hearing afterward that someone went through something really hard and
Yeah.
nobody knew.
I'm right. Right.
That's heartbreaking when you have the resources and you want to help. You would have
Yes.
if you had known. So thank
It's
you.
funny, like even in the group of 8, and again, like it sounds like, oh, that was so easy. The truth was, a counselor had said to me, when you get into transplant and that go mode of treatment, it's so overwhelming for you. Don't rely solely on your husband. I mean, a counselor said this to me. She said, because first of all, men are great, at listening and talking, but not always the best. And some of your girlfriends may be easier to talk with about some of these things. So that was part of it. But of the 8, they didn't know each other. I brought them together and I said, listen, I know you from all different walks of life. We lived near each other, but we just weren't always all in the same circles. And we are all still close. Like the 8 has stayed together. And now we've seen each other through breast cancer, parents dying, it could be anything. And then you realize that in that group, now we just help each other. We're just there for each other. And so the joy of it is they help me. And then if they need me, like seriously, if anybody amongst the 8 has cancer anywhere in their
Where to go,
family, I'm usually their first phone call, right? But
Yeah,
then it feels really good to help back. And that's just the way the world works.
it does. Well, thank you for sharing that. I appreciate it. You know, Kathy, you began as an advocate for yourself, and then you turned into an advocate for others as becoming the CEO and founding the MMRF or co-founding the MMRF. And you have seen unbelievable things that I don't, I started 17 years ago. You started, almost twice that ago. You've seen incredible things happen over the last 25 years. Can you talk about the importance of advocacy work in cancer?
Yeah, it's so important. And yet I feel like there were times when I wished it was respected more. It's so funny. I feel like sometimes people say nonprofit sector, and people think that, we're not there to make a profit, and we're not, but we're working equally as hard. And so I think it's so important for people to understand advocacy should always be at the table. The advocacy groups represent firsthand the patients better than anybody. And the advocacy groups, as I said before, what I love about them is that they're a trusted third party. They don't have a favorite doctor, a favorite drug, a favorite trial. They just want to make sure that every patient is taken care of really well. So there are a number of ways that advocacy really makes a difference. And I have a sense that it's hard to do all of these things, right? So at the MMRF, we were very much a research foundation because there were no drugs. There was just nothing for our patients. So in order to bring hope, that was our laser focus. And then we had to do education, because what's the point of getting these drugs to market if we're not educating you that they're available and where you get them? But there were times when people really, really wanted me to cover policy, and I couldn't, because it's really hard to do everything. And so I think one of the things that's really great about all of us that live in the advocacy space is you don't have to do everything, and it's okay. Do what's right, what you truly believe is right for your patient group, and then refer the patient to other resources if it's on the policy side or financial side or things that you're not handling, and just provide the names of other advocacy groups that are doing that kind of work. So I think that's the most important thing. And what I love about your focus is it's hard to have a disease that's diagnosed late stage, and the focus has to be getting treatments for the patients. Like, where else do you find hope? So I'm so empathetic with that, and so appreciative of the laser vision to get that done, and the focus on making sure everybody in the system is collaborating, from academia to pharma, biotech, and FDA, because without people like you, it doesn't happen. It just doesn't happen. So that's why when I say, like, I wish it was always at the table, and I wish the patients and everybody in the community truly understood how important the advocacy work truly is.
Yeah, I agree. It's just work that can't get done unless you have one
Yeah.
hub that's pulling all of
Yes.
those
Yes.
independent pieces together. You talked about hope, Kathy. Can you just share a little bit about what you're seeing in the future, cancer generally, and what kind of message can you share with the patients who are in our community who are trying to be hopeful?
Yeah. Yeah. I always say to everybody, like, you don't know, and I'll use myeloma as an example, but I mean, here we were when I was diagnosed, they said it will take $1 billion in 10 years to get a drug to market. And, since the MMRF was founded, we have over 15 drugs, and the 5-year survival has gone from 20 to 65%. And really, in all honesty, huge progress is being made most recently. And so that's because we're starting to understand the genomics of diseases, biomarkers of diseases, and then, of course, there's the whole field of immunotherapy. So the reason I say that to people is now the science is moving so fast that you really want to keep your finger on the pulse, because you don't know which technology is actually going to be the best for your form of cancer. But once you start to get hints, it's amazing me how, like, that spark just ignites. And all of a sudden, biotech and pharma is pretty quick to start building out, drug opportunities for the patient. So it's not taking the time that it used to before. And I do believe FDA is really trying to work with us to say, if there's high unmet need, we're going to help you. We're going to do the best we can to get these drugs approved quickly. So that's why I say, you know, if you can just take the right path and do everything right, as soon as you're diagnosed, it can buy you a year, and buying yourself a year can buy yourself potentially another year or two, and doing that can buy more time. And I've watched people play this game and beat the odds. I've seen it over and over again. So, you know, I always say to everybody, do not give up hope. Just don't.
Yeah, thank you. I feel like I sat here for 40 minutes just shaking my head, agreeing with everything, but I felt like when I read the book, I underlined so many things. And I thought, this is such a good point. Oh, what a great way to say that. Oh, you know, I want to wrap up by thanking you for being here with us today to talk about the book, which again is called Fatal to Fearless. It's just been an absolute pleasure for me. And I think that this book will be a blessing to anyone who reads it.
Oh, I'm glad. And Stacie, keep up your great work too. Seriously, it's amazing. Be proud.
Thank
Okay.
you so
You
much.
bet. Take care.
Thanks.